spine. Now to discuss this is Dr. Gregory Kuzmik, neurosurgeon with Hartford HealthCare's Air Neuroscience Institute in North Haven. Doctor, welcome.
Thank you.
So many of us have had this, but explain what causes a herniated disc.
Yeah, well, between each of the bones in our spine, we have a cartilage cushion called a disc. Now, these discs give us the flexibility to move and to bend our spine. But when one of these discs tears or ruptures, that's when we refer to it as a herniated disc. Now, this can happen just over time due to the natural wear and tear of living life. But some other risk factors include things like lifting heavy objects, repetitive bending or twisting related to sports, smoking, or being overweight.
All right. Doctor, tell us, what are some of the signs that someone might have a herniated disc?
Yeah, well, when a disc herniation happens in the neck, it can result in a pinched spinal nerve. When this occurs, someone may experience numbness or weakness or severe pain radiating into their arm or their hand. So symptoms like this are certainly something that should be evaluated by a medical professional. Now, a disc herniation in the neck can also result in a pinched spinal cord, and this can be a potentially dangerous situation that can put someone at risk for a potentially permanent spinal cord injury.
All right, so doctor, tell us, what is the latest and greatest on fixing this problem?
Yeah, well, certainly we evaluate each patient on an individual basis, but surgical treatment is often an option. Now, the traditional method of treating disc herniations in the neck is to do what's called a discectomy infusion procedure. This is a very effective procedure, but it was actually developed back in the 1950s, and there are some downsides to fusing the bones in the neck. A cervical disc replacement procedure is a more modern alternative, and this allows someone to preserve the range of motion in their neck and reduces the risk that they might need additional surgery in the future.
All right, and doctor, finally, getting an appointment to see a doctor can take time. So you're doing things a little differently, especially for those in pain?
Yeah, well, I believe that cervical issues should never be taken lightly. So when someone does have a problem like this, I make sure to get them in for an evaluation as soon as possible, typically within 24 hours. Anyone dealing with pain like this shouldn't have to wait. We do have options to improve quality of life, and sometimes waiting can make these problems worse.
And doctor, is this a condition that can return for people?
It can, but typically we try and treat it in such a way that it reduces the risk of any recurrence.
All right, Hartford HealthCare, Dr. Gregory Kuzmik, thank you so much for joining us with this great information on neck and back pain.
Absolutely.